So my name is Roberto Galea from University Hospital of Bern, and today we are going to talk about the 3-year outcomes from SWISS-APERO trial. The SWISS-APERO trial is a multi-center randomized clinical trial designed in 2017 in order to assess if Amulet is superior or not to Watchman in terms of a composite of residual LA patency as evaluated by 45-day CT and the crossover to the non-randomly allocated devices occurred during the procedure. We decided to include the residual LA patency in the primary endpoint since in 2017 we thought this had clinical relevance. And actually this was confirmed in the last 3 years by 2 multi-center observational studies conducted in US and 1 sub-study from Amulet AD. Then we decided also to include the crossover to the non-randomly allocated device in order to capture the feasibility of the device implantation during the procedure. And we decided to assess this primary endpoint by means of CT. That is the most sensitive imaging exam to detect residual LA patency after procedure. So we decided to include these 2 devices in our trial since these are the 2 most frequently used LA closure devices in clinical practice worldwide, and are actually the only 2 devices with both FDA and EMA approvals. This study can be also used as a comparison between 2 different systems of percutaneous closure. A single closure system device has Watchman FLX, and a double closure system has Amulet device. So the SWISS-APERO trial is a multi-center randomized clinical trial, including 8 European centers. We screen basically all percutaneous left atrial appendage closures scheduled at the participating centers, and we include only patients with non-valvular atrial fibrillation with a CHA2DS score greater or equal than 2 and a high bleeding risk, defined as either an Hasbled score greater or equal than 3 or a high bleeding risk criteria according to the consensus document of Munich published in 2017. Then we excluded the LA morphologies not suitable for both devices. So we observe at the 3 years, that is the current sub-study, a trend toward a lower ischemic risk observed in the Amulet group as compared to Watchman FLX group in terms of composite of cardiovascular death, stroke, TIA, or systemic embolism. However, in the as-treated and the per-protocol population, we observe a significant difference in favor of Amulet as compared to Watchman FLX in terms of composite of cardiovascular death, stroke, TIA, or systemic embolism. On the other hand, we did not observe any difference in terms of major bleedings between the 2 groups and in terms of device-related complication, despite numerically lower rates of device-related complication were observed in the Amulet as compared to Watchman FLX group. So this is a very important question. I think that the results of this sub-study can have provide 2 very important messages. One, from a clinical perspective, is for the LA closure operators that should be encouraged to implant any of these one of these 2 devices based on the confidence that they have with these devices. Knowing that these 2 devices provided a similar protection against ischemic outcomes at 3 years after procedure. From a research point of view, these results provided a warning flag, I guess, with that should be better investigated in further and larger randomized clinical trial adequately powered for detecting differences in clinical outcomes between the 2 devices.